This is Jeff Evans reporting from the annual meeting of the Endocrine Society for Global Medical News Network. The Society's president, Dr. Robert Carey, spoke at a press conference where he issued the organization's first ever scientific statement on the topic of endocrine disrupting chemicals.
In this first scientific statement on EDCs, developed by the group of experts in the field and published in this month's issue of our journal, Endocrine Reviews, which is a very high-impact journal, we present evidence that endocrine disruptors do have effects on male and female reproduction, breast development and cancer, prostate cancer, neuroendocrinology, thyroid disease, metabolism and obesity, and for myself, cardiovascular endocrinology. That's how hormones relate to blood vessels and the heart. The evidence is based on results from studies in animal models, human clinical observations, and epidemiologic studies that converge to implicate EDCs as a significant concern for public health. And within this first ever scientific statement, we also make a number of recommendations to increase the understanding of the effects of EDCs, including enhancing basic and clinical research and advocating for the involvement of individual and scientific society stakeholders in communicating and implementing changes in public policy and awareness.
Dr. Hugh Taylor, who presented research on the endocrine disruptor bisphenol A at the press conference, described ways in which patients can reduce their exposure to bisphenol A. Dr. Taylor, could you tell me about what clinical situations clinicians might want to be especially careful in asking patients about their history with endocrine disrupting chemicals?
Well, I think it's probably important for anyone, but one of the most vulnerable time periods is when the body's still developing. So children, and probably even more sensitive, is the fetus. So my biggest concern is women trying to conceive or newly pregnant. When those organ systems are forming, we know that they're particularly sensitive to these effects. So I ask anybody who's thinking about having a child or who is pregnant to think about what kind of food they're eating, where they're getting most of their food. If it's from canned goods, is it from plastic bottles? Probably not a good idea during that time period.
Are there any particular things that men or women need to be careful about in that regard? Or particularly when we talk about those that are specific to various sexes, the phthalates in men can block testosterone action. They're in a lot of the soft plastics, the flexible plastics. They're in shower curtains. That new car smell is from phthalates. It's in air fresheners. Try and avoid those if possible. They're pretty widespread and hard to avoid, but they can be avoided. They're in a lot of cosmetic goods, which many men aren't using, but their spouses or significant others may be using them. For women, it's bisphenol A is the estrogen-like endocrine disruptor that we're most concerned about. And again, the main source of that is dietary, plastic and canned goods. And should diabetic patients be concerned, especially if they have impaired renal function that was mentioned during the conference?
Impaired renal function, we worry about the ability to clear the bisphenol A. It may hang around longer. We don't know that for sure, but it's a strong possibility. But bisphenol A higher levels have been associated with diabetes, insulin resistance, obesity. It may be particularly concerning to the diabetic population or those at risk for diabetes. Those who have diabetes in their family, who may have some insulin resistance themselves, or who may be overweight.
This is Jeff Evans for GMNN.